One New York doctor claims to have kept hundreds of coronavirus patients out of the hospital with a cocktail of medications. Now, it has been criticized as unproven, but now a major hospital in our area is launching a clinical trial based on this treatment. CBS 2's Carolyn Gusoff has this exclusive story.
In the village of Curious Joel in Orange County, a self-described country doctor says a cocktail of medicines keeps his patients alive. Weeks ago, he recorded this message for President Trump.
I'm seeing tremendous positive results. I have not sent any patient to the hospital yet, even though I've treated hundreds already.
Dr. Vladimir Zelenko prescribes the malaria drug hydroxychloroquine, but only when two other substances are added, an antibiotic and zinc.
All that hydroxychloroquine does is opens a door and lets the zinc in.
Hydroxychloroquine got the president's attention and swiftly got him criticism for touting unfounded cures.
There are people dying. If it works, it'd be great.
But it's Zelenko's combination of meds and given early on when people first get sick that make his protocol unique. He claims of his 400 patients at high risk for severe illness, only 2 died. But in New York State, a catch-22. To prevent shortages, pharmacists can only dispense hydroxychloroquine for severe hospital-based cases. By then, Zelenko says it's ineffective.
There's a very narrow window of opportunity where you can hit this virus hard and early, where it makes all the difference.
Now science will weigh in. St. Francis Hospital in Roslyn is launching a study essentially using Zelenko's cocktail on newly symptomatic patients with underlying conditions. Hydroxychloroquine and zinc will be given to all of them. 2 groups will receive different antibiotics. Cardiologist Dr. Avni Thakur is the study's principal investigator.
What we know about the mechanism of action of the drug suggests that they could be helpful early in the course of a viral infection. So what we know about zinc is that it's an antiviral. We know that hydroxychloroquine can help reduce an immune response that could get out of control. And we also know that hydroxychloroquine helps zinc come inside the cell.
Administered early rather than as a Hail Mary for the sickest, which has had disappointing results. And to protect participants from any increased heart risk that have prompted safety concerns,
We're going to be monitoring their EKG from home.
In all touted treatments, data is first needed, says cardiologist Dr. Alan Kadish, president of Toro College.
All drugs have some side effects, and we don't want to treat millions of people with a combination that we don't know is safe and effective.
If we can manage this early and control it and prevent people from getting very sick and getting hospitalized, that's where we need to have, I think, good data and good science.
Zelenko, who's offered up his cases for peer review, is hopeful.
This is an absolute revolution in how this disease will be treated.
The study will enroll 750 patients with early symptoms. They can simply come to the St. Francis Hospital ER or call the COVID trial hotline on our website. Early results expected by midsummer. In Roslyn, Long Island, Carolyn Gusoff, CBS 2 News.